Thank you, operator. And thank you to everyone for joining us for the COVID-19 media call for August 28th. We'll start today with a situation report from MDH Infectious Disease Director Chris Ayers, and after that, we'll open it up for questions from reporters on the line. With that, I'll now turn it over to Chris.
Thank you, Mike. Globally, as of this morning, we were at 24.4 million cases and 832,000 deaths. The United States was at 5.8 million cases and 180,000 deaths. In Minnesota, we went up 862 cases from yesterday for a new total of 73,240 cases in Minnesota. The median age of our cases continues to be 36 years old. We added 4 deaths yesterday for a total of 1,810 deaths in Minnesota. 2 of these deaths occurred in residents of long-term care facilities, 2 in Ramsey County, and 1 each in Hennepin and Stearns counties. The total includes 3 individuals in their 80s and 1 in their 70s. There are 301 patients currently hospitalized, with 137 in intensive care. Just like to give you a couple of updates related to the Sturgis motorcycle gathering. We are now at 44 cases, 2 hospitalizations, including 1 in ICU, and we're also starting to see secondary transmission to close contacts. And I'd like to talk a little bit about higher education. As students return to campus, we have some preliminary data that shows how important our lay low before your go message continues to be. Preliminary case data unfortunately demonstrates quite clearly the risk of students and staff bringing COVID with them when they return to campus. It's important to recognize that just because a college has an outbreak, that doesn't necessarily mean the institution did something wrong. In fact, most of the cases associated with a college or university setting that we saw during the week of August 17th likely occurred off campus. According to aggregate preliminary data, starting the week of August 17th, which is when colleges and universities started coming back for the fall, we've had 254 cases reported to the Department of Health, where the person had some association with a college or university, either faculty, staff, or students. 206 were students, 39 were staff, and only 30 of these cases lived on campus at the time of report. Of those 254 cases, 90 were on campus while infectious. And of those 90 cases, 62 were students and 24 were staff. 51 colleges have reported at least 1 case in the last week. 7 colleges have reported 5 or more. There are close to 200 colleges and universities in Minnesota. I want to talk a little bit about the rising case numbers that we're seeing. This is another day with high numbers of new cases. Yesterday's high number of cases was partially due to adding a backlog of cases and tests from a particular provider. But in general, we are seeing some upticks in our numbers that are concerning. We're hearing reports of events or instances where people are not following our guidelines or the executive orders, and this has led to cases and outbreaks and further spread of disease. We've identified 21 clusters of COVID cases associated with parties, events, etc., just in August. To date, we've received 1,086 complaints of executive order violations, with masking noncompliance the most common category. This has been a long road, and I know many thought we would be at the end by now, but unfortunately we're not. We still need everyone to do their part in preventing the spread of COVID. Wearing a mask, social distancing, that is keeping 6 feet of space between people, and washing your hands really does work. Not doing these things just delays our ability to do more of the things we want to do. Have in-person learning at schools, visit loved ones in long-term care, have more indoor dining at restaurants, participate in social events, and so much more. Every day is one day closer to an effective vaccine, and our protective guidance is designed to prevent as many illnesses, deaths, and long-term health problems as possible. As we count down the days to a time when we have an effective vaccine available, we can take the perspective that every day you or a friend or family member doesn't get COVID is a victory. We can do this. We have to do it together, but we can do it. I also want to clarify some of our testing recommendations, as that's another key piece of this puzzle. Earlier this week, the federal recommendation to test people who are asymptomatic, even if they had close contact with a known case, was removed. We are not changing our guidance here in Minnesota. As long as we have the testing capacity, it is important to test people who have had close contact with a known case, even if they don't have symptoms. This is because it allows us to identify likely cases earlier. Every case was once a contact. We know these individuals have had a confirmed exposure. Many will develop illness, and a certain portion of these will not have symptoms. So testing of asymptomatic individuals who we know were exposed will help us identify potential cases earlier. Related to that, we know that there may be confusion around how long someone who is a close contact needs to stay home, even if they get tested. So I want to lay that out. If a person has close contact with someone known to have COVID, they need to quarantine, meaning stay at home for 14 days. A close contact is defined as being within 6 feet of someone with COVID-19 for at least 15 minutes. The reason it's 14 days is because that's the incubation period for COVID-19. After a person is exposed, they could develop COVID-19 anywhere from 2 to 14 days after that exposure. As we've learned through this pandemic, some people with COVID-19 develop symptoms, but some don't. That's why it's important for people to stay home the entire 14 days so you don't risk spreading the disease to others, especially someone who might get severely ill from COVID. As I mentioned, people who are close contacts of a case are recommended to get tested, even if they don't have symptoms. If they get a negative test result, say on day 7 of quarantine, that does not mean they can stop staying home. You can't test yourself out of quarantine. There is no get out of jail free cards like Monopoly. We recommend this testing to catch early cases, but it's just one point in time. Since the incubation period is 14 days, you could still become sick with COVID later in the quarantine period. That's why even if you're tested negative at 7 days, we need you to stay home all 14 days. There's no shortcut. Stopping quarantine too early and then exposing or infecting others just means we'll continue this cycle of having to ask people to stay home from work, school, and other activities, which disrupts many aspects of our lives. This is a big ask. It means some sacrifices. As we're talking about school starting, we know that this may be a real burden for some students and families, as it might mean missed soccer games and other favorite activities. But it's what's needed to keep schools open and keep students, teachers, staff, and whole communities safe. During this school year, parents can help by staying in touch with their school's COVID program coordinator if their children have symptoms of COVID-19, has tested positive, or is being tested. They can also help by following recommendations from public health workers if they call to follow up on a positive test or exposure. Students can help by wearing their masks, keeping space between people, and washing their hands often when in school or other settings. Teachers and staff can help by following their school's plan, staying in touch with families, and doing their part to wear a mask and social distance when in school or when in their communities. Thank you. And with that, I'll turn it back to Mike.
Thanks, Chris. Operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press *1 on your telephone. Again, press * then the number 1 on your telephone keypad. Your first question comes from the line of Emily Havoc from Care 11. The line is open.
Hey, Chris. Thanks for going into some of the rising case numbers. I just want to follow up on that. Actually, first, I did have a clarification about the Sturgis cases. You said there are 44 now, but you have seen secondary transmission. So do those 44 include now people who didn't actually attend, but they're contacts of those people?
Emily, I'm really glad you asked that because I realized that in my talking points, we say 44, but I got updated numbers just before I went on the call. We're actually at 46 cases. So just to clarify, with Sturgis, we're at 46 cases now, and the secondary cases are not included in that number. So 46 cases, 45 households, but it does not include secondary cases. And we've been made aware that there may have been exposures at a wedding as part of secondary cases. So definitely expect to see more transmission associated with that.
Thanks, Chris. And then back to just the rising case numbers. How are you tracking that, especially with this backlog and kind of the confusion around the daily case numbers right now? I guess, can you explain a little more about how you're identifying a rising trend?
Oh, certainly. So, we talked about the fact that we had a provider who had not been reporting cases to us for many months. We worked to add the cases that we were aware from the last 2 weeks from that provider, and they got added yesterday. We will be adding more cases down the road, but we wanted to focus on the cases that we could, intervene in terms of a public health intervention. For cases that are, 2 months back, it's obviously far too late. But we can identify the number of cases from that particular laboratory, and so we're able to differentiate what were positive cases associated with that versus what are the cases that are coming in through our normal reporting. And so that's why we're able to say that, yes, that certainly accounted for a number of cases yesterday, but we continue to see a very disturbing trend of increasing cases. And we're seeing many, many more cases that are linked to social outbreaks. So we've had 76 social outbreaks to date with 562 people affected, and we're continuing to see that as our primary source of spread at this point, in addition to, what I said about institutions of higher ed, although, as I acknowledged, most of that transmission has been social rather than on campus.
Thank you, Chris. And if I can ask a follow-up, any of those recent clusters that you're seeing from events where you can tell us more specifics about what the event was and where?
Certainly, we know that there was a large wedding in Lyon County. Obviously, we've been talking about Sturgis. There's been some large funerals that have accounted for cases. So, we've obviously seen cases associated with some bars and restaurants, but we're also seeing it with weddings, with funerals, and then with some of these, large fairs or festivals like Sturgis would be.
Thank you, Chris.
Yep.
Your next question comes from Matt Stefik of MPR News. Your line is open.
Hi, Chris. I have a question about the specific kinds of events where the spread of the virus has been documented. Does your data make any differentiation between those held inside and outside? And if so, what was the difference in the number of cases between events held indoors versus those held outside?
Thanks, Matt. We don't get into that level of detail. We certainly know that some events actually go both ways. So, for instance, some bars and restaurants have both indoor and outdoor seating. Generally, however, what we're hearing about in the events where we're seeing cases is really a lack of masking, a lack of social distancing, things that even the benefit of being outdoors would not account for or would not help to mitigate.
Okay, thank you.
Your next question comes from Jeremy Olson of the Star Tribune. Your line is open.
Hi, Chris. So yesterday, the president had pledged a vaccine by the end of the year, and he's not the only one that's made that prediction over the course of the pandemic. But that kind of accelerates the discussion about when and if we get a vaccine, who's going to get it. And you had mentioned before that Minnesota is part of a pilot group that's doing some of the planning on prioritizing who gets those first doses of vaccine. And I believe you had some meeting or session on that recently. Can you tell me a little bit about where that's at in terms of figuring out who gets it first?
Certainly. We did have a virtual, virtual visit from CDC and the Department of Defense on Monday and Tuesday of this week. And the focus was to discuss planning for the COVID-19 vaccination. And our conversation obviously included a number of people on the federal side, but it included, immunization staff, our emergency preparedness staff, staff from the governor's office, and then importantly, partners from local public health, from tribal health, from some pharmacies, and then diverse community members. And it was really a really positive back and forth dialogue. We talked a little bit about what did we learn from H1N1 vaccination. And so one of the things that we learned was that it's better to underpromise and overdeliver. So while we're delighted that there are projections for a vaccine by the end of 2020, we want people to realize that, getting a vaccine licensed and through all the safety protocols does take time. And so it'd be great if we were ready by then, but don't be surprised if we're not either. We talked a little bit about the need for consistency across states because obviously Minnesota borders on a number of states. So we want to make sure that we're doing consistent things across states, particularly for our partners, right on the border. And when we talked about, vaccine availability and supply, the CDC acknowledged that initially the supply was expected to be very limited and very targeted. So it would likely be available for critical workforce such as healthcare. We specifically called out the importance of making sure that our long-term care healthcare workers were able to be vaccinated because that was really where we felt that there was a high need. And CDC did share our concern for that population and workforce. But we talked a little bit about those things. And when CDC would give us information about something, then we had the chance to say, this is something that would be an issue in Minnesota. So for instance, when we talked about critical infrastructure, there's obviously a lot of different sectors that can be part of that. But when you think about like a difference between states, in Minnesota, it may be that our snowplow drivers are determined to be critical, whereas Hawaii, that would not be an issue for them at all. So, we talked a little bit about some of those things. They did also indicate that the vaccine could come out as an emergency use authorization, in which case it would have some limitations about who could receive it. So that is something that, we're looking at. And then just that they're really expecting that it will be a 2-dose vaccine. And so because there are multiple different manufacturers of the vaccine at this point, one of the things that we have to consider is technology to make sure that if you get your first dose from manufacturer X, that you get that second dose from that same manufacturer. And so there'll be some, technology needs to make sure we can track that. I think probably though, we went into details about syringes and PPE and lots of technical stuff. But I think the most important thing we talked about was addressing, concerns about this vaccine and making sure that the public would feel confident about it. And we felt that for certain communities, in fact, communities that we think it's really, really important get vaccinated, that they have had, historic trauma as it relates to medical research and medical treatments. And so it's going to be really important that the work that we do, in addition to thinking about all the logistics, and there are many, along with vaccination, is that we really work with our community partners, that we really have to have trusted messengers from the community. We have to talk to the community and hear, how is this going to work for you? Where should we be vaccinated? What locations are most comfortable? All of those things. So I think even as we discussed lots of details, the takeaway message was the importance of making sure that communities are really critical and are very involved in our planning process. And I suppose one thing I just want to clarify, because the one thing we also said was, the name of this project is Operation Warp Speed. And I understand that, the intent is we be as efficient at getting this vaccine out as possible. But we sort of joked and said, could you rename it Operation Safe Speed? Because what we really want people to know is that these vaccines are going through the safety protocols, but what's different is not scrimping on safety, but rather that normally you don't start manufacturing a vaccine until all the safety protocols have been met, because it's too much of a financial risk. And in the case of COVID vaccine, the federal government has made the decision to carry that financial risk and to say, we want you to start manufacturing. And we know that some of these vaccines won't meet the safety profile and we'll just lose that money. But we want to have a vaccine that's ready to go as soon as it does meet the safety profile. So that was an extremely long answer, but kind of highlights some of the key points from our meeting.
And one quick follow-up, just was there any assessment of how many people would need to be vaccinated, or what kind of herd immunity rate through people infected and combination with vaccine will be enough to get us out of this?
No, we didn't specifically talk about herd immunity. We do know that for different diseases, the required herd immunity is different. So obviously for measles, we need to have pretty high levels of herd immunity. I've heard talk about 60 to 70% between both individuals who've had the disease and those that are vaccinated. But the things you have to consider are, what's the vaccine effectiveness, and what will the uptake be? So, what proportion of the population will get it? What proportion of the population that is vaccinated will have complete protection? And then obviously the big question is, how long will that protection last? And so lots of things to learn and to consider, but not a specific answer to that question.
Thank you.
Your next question comes from Brian Arola of Mankato Free Press. Your line is open.
Hi, thanks for taking my question. I'm just wondering, if a college student gets tested and is found to have COVID, does the health department have any recommendation on whether that student should be counted as a case in the county they're going to college in, or the county where they're from? Is there any recommendation on that, or a way that the health department handles that?
Thank you. A really good question from somebody in a university town. Generally, a person's case is counted with their permanent residence. However, we also recognize that for students, their current residence is their college setting. So if it's somebody who's, living on campus and in a dorm, we would be looking at, where are they living at the time that they had COVID. I know some people have said, well, if you're traveling to northern Minnesota and you get COVID, then are you going to get counted in, the case numbers for northeastern Minnesota and not in your home county? In that situation, that's not the case. But in the case of colleges and universities, those students are physically living on campus or in that community, and so would get counted there.
Thank you.
Please press star 1 if you would like to ask a question. Your next question comes from Alex Chokich of KSTP TV. Your line is open.
Hi, thanks so much for taking this question today. So I wanted to ask about the new test that got the FDA authorization, the Abbott Labs test, that is the 15-minute test similar to a pregnancy test that has the reactive card and doesn't need, extra lab materials or even to go to a lab at all. I'm curious your guys' thoughts on this test. First of all, that'd be the first part of my question. And second of all, have you heard anything about when Minnesota might start to get some of these tests, or how many might come here? I know the president had addressed last night that the federal government's ordering 150 million tests, so just didn't know if we know Minnesota's, position in all of this.
Alex, I don't know how many tests might be coming to Minnesota, so I don't have an answer for you on that. And in terms of the new test, one of the things that obviously is beneficial is that it's those type of tests are able to be done in a point of care setting. So in other words, as you said, you don't have to go to a special lab or anything like that. The challenge for providers and for us at the health department is that we still need to get those results. And oftentimes the providers who use those point of care tests don't have the ability to electronically report laboratory information to us. So it gets to be a little bit challenging in that regard. So that's just one element. That's not intended to suggest that it couldn't be and won't be a useful tool, but just a consideration. And then the other thing is that the federal government is looking to put a number of these point of care tests, make them available to long-term care in, our attempt to really continue to get a handle on what's happening there. But again, the challenge is if a test takes 15 minutes, which obviously in all of life is a short amount of time, but if you have to test, 100 staff, you can imagine that would start to take quite a while to get that done. So there's definitely a place for these, and we're glad for increasing test capacity, but there are also some limitations.
All right, thank you. Are there any other thoughts on this test? Any other reaction to being able to test larger numbers of people? And specifically, I don't know if you guys have seen, but they also have an app that they developed with the test so that you can show that you're negative and scan into places. And one of the thoughts that I had is, it sounds great, but how will that work as far as like, how old were your test results? So if you took that test 3 weeks ago and you tested negative, and now you're using it to scan into, say, an airport, is that still accurate?
Right, absolutely. In fact, that app would be really, in a way, meaningless because, as we talked about, a test result is only really valid. It only tells you that you were negative on the day that you were tested. So, for instance, if you have a test result of negative and you're 3 weeks out, you could easily have acquired COVID in that time and be infectious. So that's less of a useful thing than the fact that there's a point of care test available. If you think about it, think about how healthcare handles things. Even when they're pre-testing patients prior to surgery, they want your test results very, very close to the time that they're willing to do surgery on you. They would never allow for 3 weeks. So I think, the idea that the public needs to realize is a negative test result is only good, and it tells you were negative on the day that you got tested.
Very good. Thank you so much. I appreciate it. Any other thoughts on this particular situation?
Nope, that's it. Thank you.
Thank you so much.
Operator, we have time for one more question.
Thank you. Your next question comes from Jason Miles of WCCTO-TV. Your line is open.
Hi, Chris. Thanks for taking my question. I was wondering, are there any plans to have increased enforcement or resources on COVID-19 regulations at bars and restaurants as cases rise?
Yes, actually, we are looking at that. Our public safety and health officials are going to start increased compliance checks at bars and restaurants throughout Minnesota in the coming weeks, beginning today. Over the last number of weeks, both the Department of Health, the Minnesota Department of Labor and Industry, and the Minnesota Department of Public Safety's Alcohol and Gambling Enforcement Division have all received complaints from both customers and owners or operators of bars and restaurants about establishments that have not been complying with requirements of the executive orders that are intended to protect us and limit the spread of COVID. And so because of that, we will be increasing enforcement. Now, I want to be clear that we know that most establishments are following federal and state guidelines, but it's really hard for them to compete or even to explain to their customers why they are following the guidelines when there are other establishments who are not in compliance. And we know that when establishments and customers don't follow the guidance, we see outbreaks and we continue to see spread in our communities. So, we owe it, meaning state government, to the establishments that are following the guidelines to address issues of noncompliance, because for the folks that are following the guidelines and for those establishments, they need us to support them in doing the right thing. So that's why we're going to be working together. So the 3 agencies will visit multiple establishments every weekend for the next few weeks to make sure to identify non-compliance and to have conversations about the importance of compliance.
Great. So these will basically be checking in on establishments that have had complaints against them?
Establishments that have had complaints, as well as just some random checks. They'll be focusing on the various executive orders. So focusing on the executive order that promotes public health and worker safety, all those things. So yes, that's what they'll be looking at.
All right. Thank you.
Yeah.
That is all the time we have for today's call. If you have a question afterward, please feel free to reach out to the MDH Communications office. Have a good day, and we'll be back with you again on Monday.
Ladies and
That was state health leaders.